That is, what's next, right? It's a question we love to ask in Michigan. It's in our DNA as tough.
For weeks, we have been talking about the price of gas and we've been feeling it, but some relief could be on the way. House Democrats want to give you some money to help with the sticker shock. The proposal would send an energy rebate of $100 per month to individuals or $200 for couples, plus $100 for each dependent for each month the national gas price.
So good news, the more states have finally decided to approve more financial assistance to the low income. States like Tennessee and Georgia have approved bonus payments for some residents. These payments may be worth as much as $500, but there are strict requirements that need to be met in order to qualify. And now, we can finally expect more stimulus to be sent out. The Tennessee Department of Human Services is providing extra support for families to receive cash assistance in the amount of $500. The Tennessee Department of Human Services will provide financial assistance through its Family First program. Households that are part of the program will receive a one-time additional payment of $500 on their existing electronic benefit transfer cards. One-time payments have already begun being sent to eligible families. This one-time boost in financial assistance is intended to help families and first participants overcome these temporary hurdles. We serve some of the most economically vulnerable families, said the commissioner, and children through the Families First program. He recognized the challenges they're facing and keeps
to expand benefits. And what this amendment says is do not cut Social Security. Now, I think a number of my Republican friends will say, well, we're not going to cut Social Security for anybody on Social Security today.
So about 16 million Americans will lose their unemployment benefits this week. Multiple lawmakers in Congress are urging the White House to send out another stimulus check of $1,000 and even $2,000 a month. Many lawmakers in Congress want President Biden to send out a fourth stimulus check very soon. There's one big issue, and it's that Democrats and Republicans can't seem to get along. They're actually holding back our stimulus check money.
Economists tell us, spend the money, invest the money for those who need it the most, because they will spend it. It will be a stimulus, or at least a stabilization and that's a good thing.
The argument is over how much is appropriate at this particular juncture as we struggle to get the economy back.
According to state officials in Connecticut, healthcare workers, grocery store employees, and private sector employees who staffed vital services during the first 2 years of the crisis can begin applying for up to $1,000. It won't be clear until early October where the applicants will receive as much as $1,000, and that's because legislators and the governor, Ned Lamont, allocated just $30 million for the program. He said that Connecticut's essential workers have gone above and beyond during the crisis to keep the state running and safe. The new premium pay program is another way for us to return the favor, for these funds are truly meaningful. Every essential worker needs to know that they're available. To be eligible, an applicant must have worked between March 10th and May 7th of 2022 in one of these occupations that the state has listed. Some of the frontline workers in these categories include healthcare personnel. Eligible applicants must earn at least. Some of the frontline workers in these categories include healthcare personnel, food and agricultural workers, grocery store staff, and public transit workers. Applicants must earn less than $150,000 per year and cannot be employed by a federal or state entity. Full-time workers who earn less than $100,000 can apply for a $1,000 grant. Those earning more than $100,000 but less than $150,000 are eligible for grants on a sliding scale, ranging as low as $200. Part-timers working less than 30 hours a week can apply for a $500 grant. The application period will run until October 1st, and the goal is to process requests within a 60-day window. And for the people who need their money, SNAP recipients nationwide are at risk of losing their benefits by 2025 under the bill. Joe Biden has signed a bill into law to suspend the limit, but also change the work requirements for older adults. The new agreement will now expand work requirements for adults 50 to 54 years old, and currently SNAP dictates that adults 18 to 49 can only receive checks for 3 months out of every 3 years, unless they work at least 20 hours a week. Experts have said this puts 750,000 older adults ages 50 to 54 at risk of losing food assistance. Veterans and kids aging out of foster care and homelessness are exempt from this new type changes. These changes are expected to be in place until 2030, and there are new exemptions to the rule. Experts have said that SNAP governments in charge of administering SNAP can waive the work requirements for areas with high levels of unemployment. SNAP departments in Pennsylvania, for instance, New Jersey have already planned to apply for new waivers depending on what the USDA will allow. But the end of the public health emergency on May 11th has created several changes for Medicare beneficiaries. Whether Medicare will or will not cover a certain healthcare cost may now depend on whether you are in traditional Medicare or a private insurer of the Advantage plan. Now, the former president administration declared a public health emergency in January of 2020, but this May it has decided to end it. During the public health emergency, Medicare plans were not allowed to change or move members out of work network officiants. But those protections have ended, and people will once again either have to pay more or not have coverage depending on their Medicare Advantage plan. And the good news is that Medicare beneficiaries receiving telehealth will be able to do so through at least December 31st, 2024. Telehealth is largely unaffected by the end of the public health emergency because of a 2023 law extending the telehealth coverage until next year. But the lawmakers in the Congress have discussed this and are planning to cut Social Security and Medicare. Americans are not happy with that, and few Americans would be okay with that, some politicians having suggested to shore up the programs. 80% say they oppose reducing the size of Social Security benefits, and 67% are raising against the monthly premiums for Medicare. What do you think is going to happen now, folks? Will Joe Biden get the job done in time for the fourth stimulus checks? I believe there is a chance that he can do it, folks, and he definitely should be sending out the stimulus payments by 2021.
There you go, Mr. Secretary. Let me begin by saying I know there are millions of Americans in this country who feel disappointed and discouraged or even a little bit angry about the court's decision today.
$1 trillion swing. President Obama comes in first year. He reduces the deficit, which is what contributes to national debt, by $700 billion.
Are stimulus checks going to be sent out immediately? Well, there has been new released information on $2,000 stimulus checks. The lawmakers are now negotiating on $100 stimulus payments. The gas prices are soaring nationwide, and AAA reports that the national average cost of a gallon of gas hit $5.16 as of June 14th. This is the all-time record high price, and since many people cannot eliminate gasoline usage or even significantly cut down their fuel costs, these surging prices have hit hard. As a result, lawmakers are naturally considering ways to provide relief, including potentially sending out another stimulus payment. Proposals to help the public cope with gas prices exist at the federal level as well as in some states. One plan put forth on the federal level, for example, is called the Gas Rebate Act of 2022. It would provide a monthly rebate during any month when the national average cost of gas is $4 or more. The rebate would last to the end of 2022 and would total $100 per adult and per dependent for single filers earning less than $75,000 or joint filers earning less than $150,000. It would phase out at higher income levels, with single filers getting no rebate once their income topped $80,000. And married joint filers losing the rebate with an income of $160,000 or higher. Now, state plans exist in certain locations because